specialist at ACR Health. I do HIV testing, outreach activities. I am also involved in linkage to HIV care and regular medical care.
My name's Mel. I also work for ACR Health. I'm a prevention health advocate and HIV tester. I do similar things to Alicia. Today I'll be playing the client for the testing procedure. I'll be getting tested.
And I am Dr. AC Damadan. I am an infectious diseases doctor by training. I will tell you a little bit about my history and work with HIV. I did my training in Pennsylvania and then moved to New York City and worked at Callum Lord, which is the LGBT Health Center of Manhattan, for years, and then St. Vincent's HIV clinic, and then St. Luke's Roosevelt's HIV clinic. And then I started an LGBT health center in Connecticut with a box and a cell phone, and now it has 2 offices and 7 providers and 3,000+ patients. So I have been working on PrEP, which is, the first step to get people on HIV prevention is HIV testing, which is what we'll talk about today. And it is amazing what we can do technologically, the difference between when I was young to get an HIV test and what you can do today, what you're going to see today.
How far we've come.
We've come a very long way. We used to have to take a number. It was anonymous. You would get your blood drawn. You'd have to wait 2 weeks in terror.
Mm-hmm.
And then if you were negative, you were okay. If you were positive, it was not good.
Yeah.
So we've come so far with the treatment of HIV, prevention of HIV, and the technology for testing for HIV. So I think what you're going to tell us, Alicia, is the different tests that you guys do here today.
Yep.
And then I'll expand on one of the tests that's actually going to be done.
Yep, absolutely. So we're going to start with going through our testing encounter and what it usually looks like. So prior to testing, we would go through all HIPAA and privacy practices. Consents for testing and other services are also then signed and dated. At this time, due to COVID, we are utilizing verbal consents. So I will start by asking my clients some questions. And the questions that we ask during these intake help determine what test is best for you. Mel, your current sexual identity?
Lesbian.
Current gender identity?
Female.
And sex assigned at birth?
Female.
Gender pronouns?
She, her, hers.
Okay. And have you ever been tested for HIV before?
Yes, I have.
And what was your status?
It was negative.
That's good. So I'm going to ask you a series of questions that involve your sexual history. In the last 5 months, have you had sex with women, men, transgender men, gender non-confirming, non-binary, or questioning persons?
Just women.
Okay. And was any of that sex unprotected without a condom?
Yes.
Oral?
Yes.
And vaginal and anal?
No, anal.
No. Were any of your partners in the last 6 months a person living with HIV?
No.
A person infected with hepatitis C?
No.
A person diagnosed with STI?
No.
And I know they've switched the terms in the last couple of years from STD to STI. They both mean the same thing. STD is sexually transmitted disease. STI is now the more formal term, proper term, and is sexually transmitted infection. Have you sexually involved with a person who engages in sex in order to get something they need, such as drugs or housing?
Is this also in the last 6 months?
In the last 6 months, yes, I'm sorry.
Okay. No.
In the last 6 months, a person who injects drugs?
No.
Have you, in the last 6 months, been diagnosed with an STD?
No.
And have you, in the last 6 months, been diagnosed or had sex for something that you needed, such as money, drugs, or food?
No.
Okay. Have you ever heard of PrEP?
Not really.
No? Okay. So PrEP is a great pill for HIV prevention. I have this handout that I will give to you that has frequently asked questions. So PrEP stands for pre-exposure prophylaxis, and the goal of PrEP is to prevent HIV infection. So what's really cool about this pill is that this is a pill that contains 2 HIV medications that you would take every day. And the same medications that they use to treat individuals with HIV can now be used to prevent HIV, which shows another long leap into what we have, where we once were. So I will give you those. Do you have any questions, other questions regarding PrEP?
So you said it's once a day?
Yep.
And how do you start the process of PrEP?
So you would get in contact with your primary care doctor or like a Planned Parenthood, and they would give you a PrEP screen over the phone. You would go in for an appointment, which they would then take blood from you to make sure that you are negative. And then every 3 months, you come in for a checkup to be rescreened for HIV to make sure that the pill is working properly and that you have not acquired HIV.
Okay. Is that something you help with?
Yes, absolutely. Yes, we do. We offer PrEP option right here at ACR Health. Have you ever injected drugs?
Yes.
Okay, yes. And what was your date of your last HIV test?
December 2019.
Okay. And have you had a tattoo or a tattoo from an unlicensed artist or piercing from an unlicensed piercer?
No.
And I don't know if you are aware, but those ways are forms of transmission with hepatitis C.
Okay.
Yeah. And have you ever been exposed to blood or body fluids while at work?
No.
In the last 12 months, have you have any alcohol use?
Occasionally, not very often.
Marijuana?
Yep.
Is that more than once a week, occasionally,
That's all the
daily?
time.
Anything else? K spice, K2 spice,
Nope.
cocaine,
Just the
crack?
legal stuff now.
All right, sounds good. So at this time, we're going to go through our test and we'll talk about what we offer and what the process of the test is going to be. You said that you had past injection drug use. Was it in the last 5 years?
No.
Okay. And since your last injection drug use, have you been screened for hepatitis C?
Yes.
Yes, you have. Okay, that's good. And one thing that is good to know that anybody who ever screens positive for hepatitis C are the rapid tests that we offer at this agency. Any rapid test, your test will come back positive always, even if you've been cured, because an individual who has once tested positive for hepatitis C always carries the antibodies. Okay. So another test that we offer is syphilis testing. Have you ever been tested for syphilis before?
Yes, I have.
Yes.
Before.
Have you ever tested positive for syphilis?
No, I haven't.
Okay. And that is another rapid test that we provide here at ACR Health. Again, if you have ever tested positive for syphilis, our rapid test will not be suitable for you because you will test positive again, even if it's been cleared up, because anybody who's tested positive for syphilis will always carry the antibodies. More testing, we offer lots of testing. So more testing we offer is 3-site testing for STI, which involves the urine, anal swab, and a throat swab. The reason that we offer all tests is because it has been known and is very easy for individuals to be negative in the urine, but positive in the throat or the anus.
Do you have to swab my anus for me?
No.
No.
Your own anus.
Yes.
You
That's
know,
more comfortable.
the interesting thing is that if you don't do extragenital testing for gonorrhea and chlamydia, You missed probably around 85% of all infections with gonorrhea and chlamydia.
Oh, wow.
That's a
So
lot.
that's the reason why that test has been now recommended, and it's people forget that it's always been recommended for men who have sex with men or gay and bisexual men,
Mhm.
but it gets left out of the equation for heterosexual people. But I've heard they have anal sex too. So
Yeah.
Don't
and I've also heard they use their throat for sex sometimes as well. So
absolutely.
that's why it's important to screen cisgender women for
Yep.
gonorrhea in the throat and anus too. We can't forget them. Cisgender women have been left out of the conversation about tampons and HIV
Yes.
testing. So
Yep. So
and then lesbian women especially.
Especially,
Yeah,
yes.
absolutely in the mouth. So if you like to give oral pleasure, or you like to have a little butt fun, the swab is for you.
Yes.
There was a study that was done that asked cisgender men, cisgender women, transgender men, and transgender women about the different sex acts they did.
Uh-huh.
The only thing that everybody did was have receptive anal sex, put things in their butt. So you
Oh,
are
wow.
right. Everybody likes to put things
So,
into
yeah.
their butt. So
Yes.
I don't, yeah. It's a fascinating thing. I loved your screener. Can I make a little comment on your screener?
Yes.
Yeah.
So this is a destigmatizing screener, right? This screener assumes nothing about anybody. It is a screener that is across the board and asks questions that have been shown to improve people's coming back for more HIV testing, asking about gender identity, asking about sex at birth, asking about names and pronouns. All of those things have been shown to make a person come back to you and get
Yep.
another HIV test in the future and feel comfortable in your organization. It's important to know that we ask the same questions of everybody, right?
Absolutely.
Because
Yep.
it's the same risk. So this screener, one of the biggest problems that people like women, cisgender women, have felt like they're out of the sort of that PrEP wasn't for them, that it was for gay men and
Yeah.
only, and so they didn't sort of see themselves in that equation. So when we ask the same questions of everybody, it sort of levels the playing field. So that's why that that screener is really great.
Yes.
Also, the STI portion is really important to know, because things like syphilis, for instance, in New York City, they did a study looking at syphilis, and if you tested positive for syphilis, 1 in 20 of the people became HIV positive within a year.
Oh,
And
wow.
if you test positive for rectal gonorrhea, 1 in 15 become positive, HIV positive within a year of that diagnosis. So it's sort
Yep.
of like chest pain
Mhm.
if you have coronary artery
yes.
disease, those things. It
Yeah.
makes an urgent. So that's why we do those tests.
Absolutely.
So
And a lot of people don't feel like, especially during COVID, a lot of people think, oh, my risk for HIV and STI isn't that high because we're all stuck in the house, but we're all stuck in the house doing it.
Yeah.
So, and studies, according to Rochester data, STIs have actually gone up by 77%. And the reason that is extremely scary is because when an individual contracts an STI, their risk for HIV infection rockets goes really high. And that is because your immune system is already too low to fight off. If you come in contact with HIV, you're gonna get it.
Well, it's also that the cells that become infected with HIV are the same cells that would go to fight the infection, like in your rectum, if you had gonorrhea. So that means there's more of them there. If you then are exposed,
Yeah.
that there's more cells to be infected.
Oh.
So it's kind of like when there's a big group of them, HIV can more easily infect those cells. So that's why when there's that inflammation going on, it makes it easier to contract HIV. Yeah, and there was a online survey of men of gay and bisexual men, that they actually have had more anal sex, even though they thought they weren't going to. they said they weren't going to. They knew they said, we know what the risks are for COVID. They had no willingness to stop doing it. And they actually, there's been increases in substance use, increases in anal sex, increases in STIs. And it's a major issue because of the lack of testing that happened in the beginning of COVID.
Yeah. Yeah. Hey, and it's fun. We all want to be out there doing it.
Yes.
Just protect yourself with testing and condoms and prep if necessary. Go buck wild during COVID. Nothing else to do. So I just want to state that everyone who is sexually active is at risk for contracting HIV. We are going to get more into our HIV test. And AC, do you want to explain a little bit more about it before we actually get to pricking?
The test that they are going to do today is a 4th generation HIV test. The 4th generation HIV test, I won't say the name of the brand, but it looks for both the antigen, it's called the P24 antigen, and the antibody. So the importance of a combined antigen antibody test is that it shortens the window period for when you can diagnose HIV. Because the HIV viral load after infection starts to rise around day 3, because it takes time to get from the rectum into those cells to the lymph node and then into the blood, and then you're viremic with HIV. That takes between 3 and 7 days. So that's why PEP works, right? Like if you have an exposure, you come in quickly because you get on PEP before that cell gets to the bloodstream. So
we'll discuss PEP in a little bit.
Yeah, we'll discuss PEP. So this test, the next signal to rise is the P24 antigen, because it is a portion of the envelope of HIV, a protein. And then, unfortunately, the antibody can take up to a month to start to show up. So when you do the combined test, you narrow it down to probably around 2 weeks. But it's important to make sure, like if you were really high risk, you would want to make sure that she's not acutely HIV infected, right? Because that's when people, if they're put on PrEP, they develop resistance. So if somebody's super high risk,
and why it's important to get tested every 3 months while you're on PrEP.
Yeah. So that this test is the better test. There's only one FDA approved home test though, and that's the oral swab, which we stopped using in New York in about 2009 because there were too many false positives. Yeah. So this is the great test. This is the test you want.
Okay, awesome.
A little more complicated than the oral.
So I forgot something, but we're just yep. So I'm just going to explain to you the process of what's going to happen. I'm going to prick your finger with this lancet. We are going to collect 1 pipette of blood. I will take the pipette of blood. I will dispose of it into the test. There's buffer solution, which then is taken and tripped onto the test, which helps push the blood up the test and processes the reading. What we want to happen on this test is there will be a red line by the control. We want that to be there. That means the test is working as properly as it will. Down here, if we have a line down and then in this spot or a line down here, that means that we have a reactive. We don't like to call it a positive because it needs confirmatory testing. This isn't the final test. So we would call it a preliminary positive. And then we ACR would take you for confirmatory testing if that was to happen. And in any type of support you needed from us to advocate for you and be there with you the whole time, we're there.
How do they do the confirmatory testing?
The confirmatory testing would be done at a ID clinic, which we have right here in Utica, and they draw blood and then they send it out to the lab. Absolutely.
And many times people are almost immediately started on treatment.
Yep, rapid HIV treatment, because either way, whether you're adjusted, your meds are adjusted, that medication they start you on will not hurt you or anything like that. Get our gauze. Now I know I forgot the alcohol wipe, so I'm going to wipe it with alcohol. And then I will gently collect the blood into the pipette.
This is getting it into the pipette is challenging. I think.
It is, because we have to get it into the pipette without touching the skin. So, but it's working. All right.
Look at that.
And then here you go. And here's a Band-Aid
Thank
if you
you.
would need it. And for confidentiality purposes, we will not be disposing this into the pipette and reading results. All right, but usually we would set 20-minute timer. So I'm going to set my 20-minute timer. And after 20 minutes is when we would read the results.
So we'll get back to that.
That's amazing. Look how fast that happens.
That's
20
it.
minutes.
20 minutes is all it takes.
There are actually even faster ones now too, right? There's an Insti like 60 seconds.
Yeah, 60-second
Oh.
one. Yep.
Mhm.
I've seen that.
It's just an antibody. It's not the antigen test. So
Right.
Yeah, it's just a.
This one tests for both of them, which is really good. So knowing your HIV status can be extremely empowering. Because if you don't know, you're stressed out, and it's better for your health for you to know your HIV status. So we also offer mobile testing for individuals who are not comfortable in coming into the office during these times of COVID, or just anybody who has lack of transportation. We will come to you.
that's awesome.
All righty. So while this test is running, we will cover a couple more questions. If you are positive for HIV or STD, do you fear any current or past partners will retaliate against you?
I don't know. It's a possibility.
Okay, well, when that time comes, we do offer partner services available to help you inform past partners
That's good.
if need be. Was any of your oral unprotected sex receiving or giving?
Both.
Do you share sex toys?
No.
Well, that's good. I don't know if you are aware, but sex toys can also transmit STIs just as well as regular human body parts can.
Oh yeah, I got to clean it.
Yeah. Yep. And
Yes.
do you want to explain the proper way to clean sex
Clean a
toys?
sex toy? No, but I don't think that's part of. I don't know if that's part of my job description. I mean, I've heard all kinds of different ways. Why don't you explain it? 'Cause I'm not sure
Soap
I
and
know.
water.
The dishwasher.
And it is very good for like a dildo to put a condom on before it, because it also helps the bacteria of whatever else is on there. Put a condom on, take it off, switch condoms in between partners, however you would like to do it. Just don't share them.
No.
So how long since you last had unprotected sex?
Like 24 hours.
Okay.
Whoa.
So with yeah, it's good for you, girl. So since this test has a window period, I would recommend that you come back and testing for HIV in about 2 months.
Okay.
2 to 3 months. So before you leave, we can set up that appointment for a rescreening, because this test right here will not cover your sexual encounter for last night or 2 to 3 months before that.
Okay.
Yep. So rescreening is recommended. Have you been screened for chlamydia and gonorrhea before?
Yes.
Okay. How often do you use condoms during any type of sex?
Sometimes.
Have you ever had condom use demonstrated to you?
Yes, I have.
So she has had condom use demonstrated to her. If not at this time, I would, demonstrate condom use, how to properly put on and take off a condom. And do you have are you comfortable discussing condom use with your sexual partners?
Sometimes.
Sometimes. Would you also, we offer a group called Voices Voices. It is an HIV and STI prevention group. It also, during the group, we work on condom negotiation skills within our sexual lives. Is there something that you may be interested in? Oh.
Yeah, I mean, it's only an hour, $15.
Yep, it's an hour, and everybody who participates gets a $15 gift card.
You can learn something, I guess.
All right,
do
yeah,
it.
I'll put you up. All right, good. And do you have easy access to dental dams? Or, I'm sorry, do you have easy access to condoms?
Yeah, I don't use condoms, but I get dental dams and lube and stuff here.
Yep, you don't
at
use
ACI.
male condoms, but dental dams is a form of a condom. Okay. And lubrication.
There are some really important questions on that sheet.
Yes.
The domestic intimate partner violence has been shown to reduce PrEP uptake and in both heterosexual and gay individuals. So it's important to ask those questions because people sometimes when there's a power dynamic and they can't negotiate condoms, PrEP is a concealable.
Yep.
You don't have to tell your partner that you're taking it, but you're still able to protect yourself from HIV when you're in a power dynamic that you don't control.
Absolutely.
Because some cultures, condom negotiation just really is not, and sexual assault, it's just not negotiable.
Yep.
So,
Absolutely.
Some individuals take their partner wanting to use condoms as disrespect, or maybe they're out cheating, and that's not what it's about at all. It's all about protecting yourself.
And the fact is that sex work is work, whether you want it to be or not. Sex work is work, and people get paid more to have sex without condoms than they get paid to have sex with condoms. So anytime anybody does sex work, I always, make sure that routine testing for everything, right? And definitely talk about PrEP. If you look at transgender women who do sex work, a survey showed that 75% of transgender women who do sex work had been sexually assaulted at work. So and the same for cisgender women who do sex work. So it's really those questions seem like they're just like checking a box, but they're so important to ask.
They lead to, depending on the answer of the client, they lead to a much deeper and broader spectrum of services that we could help with. Absolutely. We'll move on. Have you ever had an STD?
No, my tests have always been negative.
Okay. Do you know, I know that we discovered chlamydia, gonorrhea, and syphilis. Do you know that if you've ever been tested for trichomoniasis, herpes, warts, also known as HPV, any of those?
Yeah, I think so. I have primary care and gynecologist.
Okay, awesome. Do you have any symptoms of HIV or STDs today?
What are symptoms of HIV?
Symptoms of HIV are flu-like symptoms. Consist of fever, fatigue, abdominal pain. It's very scary. The symptoms are very like flu-like symptoms. So again, the only way to know is to get tested regularly, so that if you catch it early, you have a lot longer, greater chance of living longer and living a more healthier life.
And honestly, if somebody had those symptoms of acute HIV, so fever, sore throat, rash, lymphadenopathy, you probably would want to add an extra test, so like a viral load test, because even that antigen test may not be positive if you're having acute symptoms of HIV. So that's, some people would do that, add that test into.
Okay, good.
But Very
I
good.
just realized questions and answers. I kind of skipped past that. Okay, so we have a question from our viewers. How many times can you get tested in 1 month? Just one time. And through here for ACR Health, we recommend every 90 days, depending on your window period. HIV kits.
They want to know if we provide at-home testing kits.
We did. I am not sure if we currently still do.
We've been moving away from that more now with having testing days back open. We had that more during COVID, and I haven't heard that we're still sending them out, actually.
But I can double check on that, and whoever's interested in that can reach out to myself or Mel, and we'll figure something out for you guys. And then our services confidential. Absolutely. All services are free and confidential. We are held by HIPAA and we take it very serious.
However, if you do test HIV positive, it is reported to the state
Yes,
of New York. So
absolutely.
that in all states, it is reported. So it's confidential and anonymous.
Yes.
I mean, maybe it's not anonymous, but
No.
it's confidential. But if you test positive, it does. You are
Yes.
reported.
We report it to the appropriate medical individuals, but as far as confidential to a peer or to any other person who works in the office who's not in direct care with you, absolutely stays between us. Who is most risk for HIV?
I mean, so in the United States currently, if you looked at lifetime risk of acquisition of HIV, meaning like who's going to get HIV, if you are a Black man who has sex with men, it's a 1 in 2 lifetime risk of getting HIV. So that's like flipping a coin.
Yeah.
If you are Hispanic, gay or bisexual man, or somebody who has sex with men, it's 1 in 4. If you're a Black cisgender woman, it's 1 in 54. So, and then a Caucasian, like a white gay man, probably 1 in 11 lifetime risk. So the most at-risk groups are young people between 13 and
24.
yeah, well, 13 and 24 are second. 25 to 34 are the highest group. So, but that age group, 13 to 34, make up the majority of not only HIV infections, but adolescents make up over half of all of the STIs in the United States.
Oh.
So 66% of the chlamydia infections in the United States in 2017 were in adolescents between 13 and 24. So that's why, you know, you're talking about this STDs as a sign, as a warning sign for getting HIV. So the most at risk are young people, and people, Black and brown people, really.
Yeah.
I think that brings up an important part of our testing specifically. Our agency does not bill insurance for testing services, not for the rapid testing and the STI testing that we're talking about today. So for those younger individuals, we are available for testing. I know insurance is sometimes a barrier, especially when they're on your parents.
Insurance, yeah.
So we do keep that in mind, and there is no discrimination for age or anything else. So we, adolescent individuals can come here and get tested if they have risks. We want to make sure that, they know as well. If you're sexually active, you have a right to know.
And in New York and Connecticut and some other states, they can actually, without parental consent, get PrEP too after age 16. So it goes down to they can get anonymous HIV. They can test for all STIs and HIV without parental consent and get PrEP without parental
That's
consent.
awesome.
That's great.
They passed those laws.
That's awesome. Because lack of knowledge and education can hurt these younger children out here. not knowing what they're
Well, I
doing,
mean,
not
you look where
protected.
these kids are learning about sex. I mean,
Yep.
right? I mean, unfortunately, the way that the culture of they learn, I mean, they don't go to mom, young queer kids don't go to mom and say, Mom, can you teach me how to have anal sex, right? Like they
Yeah.
go onto
Yeah.
the internet. And honey, when you get on the internet, unfortunately, the condoms are not really a part of what you see sex-wise on the internet anymore,
No.
unlike what they were in the 90s. So it's a really tough time for adolescents if they're learning about sex in a condomless world, and then we're telling them use condoms. Like it's very challenging. So that's like a barrier you have to overcome.
Yeah,
Yeah.
absolutely.
And we know schools don't teach LGBTQ.
I was
kids
I was gonna say, I
very
think my,
well at all,
I'm
so-
pretty sure my sex ed was, if you have sex, you'll get pregnant and you might die. That was it.
Yeah, and you know the reality is that we're talking about destigmatizing sexual health.
Mhm.
Absolutely.
Sexual health doesn't just mean like you don't have an STI. It means that you're having a pleasurable,
Yeah.
safe, intimate. The WHO actually has like definitions of it. So, sexual health is part of your primary care.
Yeah, you're
Like,
regular.
Yeah.
we all have to take that in. And
You don't have to be
unfortunately,
sleeping around.
don't.
You don't, have to be using
but you
drugs.
can if you want.
Yeah,
And
you
can.
if
So you can
want.
do all those
Absolutely,
things.
just do it safe.
But that's not the only reason that you have to get tested or
Yes,
take
that's what
care
I'm
of
saying.
yourself.
Yeah. Absolutely. So this brings us to a great point. Have you heard about PEP?
No, let's talk about PEP.
Okay, cool. So I believe AC, you brought it up earlier. So PEP is a regimen of pills that they would give you if you were exposed to HIV. If somebody either exposed through work, needle puncture, somebody may have been raped, or you may have just had a drunk night and had sex and then realized the next morning, hey, this person's positive. You could go to an emergency room, your doctors, and request PEP. Tell them that you may have been exposed to HIV. And it's within 72 hours after exposure. Make it there, and they will start you on a regimen of pills, and which will help fight and block the HIV virus from attacking your system. So again, that shows we can prevent it before it happens. We can prevent it when it happens. So that's just amazing of how far HIV has come. And another cool point that I want to talk about, this is one of my favorites, is do you know what U equals U means? I'm so excited about this.
For this purpose, no, I don't.
Okay. So
That just got
let
real
me teach you
excited.
a little bit about U equals U. So the concept of U equals U is undetectable equals untransmittable as far as individuals living with HIV. An individual who is living with HIV, and if they're in their doctor's care, taking their right medications every day, they get their viral loads checked regularly, and their viral load will be so low to the point that it's undetectable through labs. That means they cannot transmit the virus to their partners sexually. Isn't that great? Isn't that amazing? Oh my gosh. So that it just blows my mind. So that also means individuals who male and female, they want to have sex without a condom and make a baby. The person who's not positive could be on PrEP, and the individual who is positive is undetectable, and everybody's safe.
And I'm gonna say that U equals U is also called TASP, or treatment as prevention. And when they look at the effectiveness of TASP, PrEP, and condoms, TASP is 100% effective at preventing HIV. If you take your PrEP, it's in the 99%. Condoms have a range somewhere between 60 and 90% because for some reason people don't know how to use.
Yeah, I was
them.
gonna say you have to know how to use it, right?
So,
Yeah.
when you look at the differences in biomedical prevention versus like barrier protection, the barrier obviously protects you from STIs. Although there are studies ongoing to be looking at biomedical prevention for syphilis and gonorrhea too, given doxycycline. So yeah, there's things
There's things a brewing.
but U equals U is a huge thing. It's
Yes,
an anti-stigma thing too, right?
absolutely.
We have a question from our audience, and it is asking if testing is free. Absolutely. All services through ACR are free and confidential. Testing services are free. AC?
So I think that one's ending the epidemic,
Epidemic.
right?
Yes.
So the question is, are we headed in the right direction for the ending the epidemic plan for the United States and globally?
Yep.
So we were headed in the right direction. And some places have gotten to 90-90-90. So 90-90-90 is the ending the epidemic plan. And they believe they can end the HIV epidemic if 90% of the people with HIV are diagnosed, they're in care, linked to care and on treatment, and that they're virally suppressed. That means
I'm
that
sorry,
they-
that's our 20-minute
our
timer.
20-minute timer. That means that if 90-90-90, that we can end the epidemic. Unfortunately, COVID has probably set us back about 10 years, back to about 2008.
Testing
We
fell.
expect about 1 million new infections and about 500,000 deaths from AIDS.
That makes me want to cry.
Due to COVID, because funds that were going to lower income countries,
Mhm.
all of the funds that they would have been using for HIV, they had to use for COVID. So you saw this huge drop in supply of HIV treatment and prevention efforts. So yeah, I mean, New York City was getting close to 90, but we will see what happens. But I know, you look at some of the data of STIs and new infections, and you can see we're back. People are shocked. They're like, "Oh, all these people are testing positive," and I said, "Yeah, that's what happened before people got HIV."
Yeah.
So, yeah, we got set back a little bit, but hopefully we'll get back to where we were.
Keep fighting
We
the
have
fight.
a fantastic new HIV division bureau chief for the CDC.
Cool.
So an out gay man. So like he's really great. So I think he'll do a lot.
Awesome. So I will give you this handout of information on U equals U. I know that you are not positive, but well, actually, we're gonna read your results to see if you are. Just kidding, that was better. Okay. So after 20 minutes, we would read these results. Now I'm just for like demonstration purposes. On us, we would see one control line. That means the test is working properly. There's no line on the second box, and there's no line on the second box down here. That means this is a negative. No HIV status here. So, and then on this test, again, we show the dark red line, which is the control line on top, which we want. Now, in the second bottom, in the second box right here, the antigens, is showing a detection line. That means that this test would be a preliminary positive for HIV, and we would do confirmatory screening to get the final result. And false positives are common with rapid tests. That's why we call them preliminary positives, not actually positives.
So this would be the positive for the antigens, and this is negative, nothing in those boxes.
And if there was a line down here with the antibodies, that would also be positive for antibodies. And at the end, once everybody has, once I've read the results and there's a clear understanding of what the results mean, I would mark down on a result sheet, which then I would give to the client. And with the result sheet also comes a second sheet that re-explains what the results mean, just in case they need any clarification afterwards. So I would give you both these.
Thank you.
You are negative for HIV. And do you have any other questions for me today?
I don't think so. So I'll have to come back in 2 to 3 months or so.
Yep, and we can schedule that appointment before I walk you up.
Okay.
If my client was now positive, what would happen was that I would collect more blood on a blood spot card, which I would send out for our own confirmatory testing. Then I would ask the client if they, would like my support to go with them to the infectious disease clinic when they got their confirmatory testing. We're usually with them the whole time from beginning to the end. We'll help advocate, answer any questions, talk to the doctors if they're, unable to, a little too nervous. So we provide full-on support management after a positive.
Oh,
A lot of
a
things.
lot of things.
Mel will start.
Yeah, a lot of people have bad experiences at their own doctor or a different type of clinic. Some people are discriminated against for their sexual identity, even gender identity. There are a lot of things that factor into that. I know personally, most doctors have never asked me anything about my risk history. So there's never really been a conversation to know that I need these type of things. Like that testing should be done regularly, and they should know if you're sexually active so that they can guide you on these things. It doesn't always happen. And that's why we're here to kind of break that down, and make you comfortable, make it a more fun experience, more lighthearted. You don't have to feel like that. You don't have to feel judged.
I mean, I think that it should be a destination clinic, like sexual health clinics should be
Like your dentist appointment.
like your dentist or your
Mhm.
getting your nails done or something. Like you're going to make sure everything's cute for you to go out later.
Yeah.
Like,
Yeah.
I think for so many years it was viewed as like a punishment. Like you did something wrong, so now we got to test you, and if you did this, then blah blah blah. All that kind
Yeah.
of stuff. And that it's just really like stigma of like sex and the way people have sex. And
Yep. Or individuals will think, oh, I don't sleep around, so I don't need tested, or I'm married and I don't need tested. And honestly, it's not about, who's, committed in a relationship or if you don't sleep around or not. It's all about if you have unprotected sex. If you are sexually active, you should get tested for your sexual health. Period.
This is an empowerment, right?
Yes.
Like,
Yes.
this is we empower people. So, the barriers of fear is one of a big barrier. People
Mhm.
are afraid that they're gonna test positive, so they don't come.
Yeah. Mhm.
And that's one of the things that happens regularly is they
Mhm.
show up very late in their disease. And if you show up very late with like AIDS, it's much more challenging to get better from it.
Yes,
So that's why
absolutely.
it's better to come in and get the test to know so that you can get on treatment earlier
Mhm.
and not get sick, as opposed to get sick and then have to try to get better when you're diagnosed. So,
Yeah.
Fear is a big barrier still today.
Absolutely.
And I think there are cultural barriers about this HIV testing. There are like, oh, I saw her over at the clinic and she must have been,
Mhm.
gossiping. And so, I mean, there's a lot of barriers, but I think if you offer this multiple services like you guys do in one place, they could be coming here for whatever. They
Yeah.
don't,
Exactly.
exactly. They could be coming here just to chit chat with you, right?
Mhm.
So
Absolutely.
I think that when it says like AIDS clinic above your door, like people don't usually come. But if it says if it's a like sort of like there's no association with a really fear-based kind of
Yep.
disease, then in your name of your organization even, or like the pictures you put up on the walls and stuff, I think it's important to do that to make it less like scary,
Yes,
Right.
absolutely.
and hire good people who can talk about sex, because
Yeah.
not everybody
Yes.
talks about sex. They can't. They just.
Yeah.
I teach the first year medical students at Quinnipiac University's sexual history lecture.
Yes.
Could you imagine getting me 3 weeks into medical school to teach you about sexual history? But I can tell right away that it's the students who are should be radiologists, right? Because, they will not be talking about sex very much. I think we don't talk about sex enough.
No,
No, it's part of your overall health.
We love it,
Any
too.
other
get
thing
your
you do
sexual
to
partner's
protect yourself.
history, sexual history. There is no shame in that. Go on a date to get tested together. New relationships, say, hey, we got to stop at ACR house. We take 2 people at once, not in
Yeah.
the same room, separate rooms, but we do take couples. And it's fun. It's fun, you leave here, maybe you have to figure things out, or you're just relieved because your status and you no longer have to worry anymore.
And also in new relationships, it's just hey, let's just make sure we're both clean to move ahead. We're both good and nothing to worry about. Our health is good, and that's a way to this may be something that happened from my past, but we're getting this done now. We're gonna get it treated. That's the important thing about getting tested and knowing it up front with HIV, with any STIs as well. Don't let it progress to the point where it's starting to affect more of your health. You want to know right away and get treated.
Yep. There are so many HIV prevention options out there that it's just a shame for an individual who would think can't happen to me, it happens to them. We should not be seeing as many infections, new infections that we are now. Please use us, utilize our services, our testing, our PrEP, all the services that we offer to keep yourself healthy.
We have one last comment from one of our listeners tonight, which says, this has been great. You ladies all are truly experts in this field, and the community is lucky to have you. Keep up the great work.
Oh, thank you. Thank you so much.
Thank you.
That's what we're here for. We really appreciate it. We just want to educate people and just offer the services that everybody needs. And like AC said, we offer at this agency such a wide range of services. Someone, you could be here for testing, the person next to you could be here to get insurance. So nobody knows why you're walking through the door. So that there's no reason to feel ashamed about that.
Absolutely.
We want to thank you all, and of course, we want to thank our special guests.
Yes, thank you.
Thank you for
having
being
me.
here.
I think I forgot to. I am the medical scientist for Gilead for HIV prevention, who covers New England.
Quite important
For
over
some
here.
reason, upstate New York is New England. But I treasure coming here. It's been so good. Thank you for having me.
That's
I
awesome.
feel it.
Bye.
Bye.
Thank you. Hope to see you soon.
Yeah.